Assalamualaikum and a very good morning. My name is Nuri Nafina Izzati binti Muhammad Razaid, metric number 198456. Today I will be presenting my final year project titled Assessment of Chemical Exposure for Embalming Laboratory. For decades, lab work has been a colossal pillar in the field of science education. Despite being extremely useful, labs constantly expose staff and students to hazardous chemicals. Chemical Health Risk Assessment, or CHRA, is an essential obligation under Malaysia's law for workplaces that involve hazardous chemicals like the laboratories. CHRA is a qualitative assessment that mandates systematic evaluation of the preventive control measures in a workplace. When a CHRA advises that employees of any workplace are likely to be exposed to hazardous substances, the employer is obligated to implement a chemical monitoring program. Monitoring data is used to verify the employee exposure to chemicals is below the permissible exposure limit developed by DOSH. However, such monitoring usually burdens employees due to its high expenses. Therefore, with limited budget, employees only perform chemical monitoring at their workplaces when a requirement is indicated by a CHRA. In many cases, exposure levels within laboratories are regarded as low at the end of a CHRA, ceasing any monitoring procedures. This can be a lagging indicator for the health and safety of workers at the workplace. Hence, this study provides a framework for low-cost exposure modeling as an alternative to the conventional workplace chemical monitoring under three main objectives. Firstly, this study aims to assist hygienists in obtaining valuable input information for exposure modeling by leveraging CHRA datasets available at hand. Secondly, it also aims to introduce a model exposure data as a complementary approach relevant to chemical monitoring using IH mode spreadsheet. Finally, it aims to simulate the scales of impact, which is threat zones in event of toxic chemical release via Aloha software. This study covered analysis of exposure to three types of hazardous materials, namely formaldehyde, ethanol, and methanol. These three chemicals are heavily handled in the place of work and investigation. Oral and dermal exposure are not considered to be relevant, hence study of exposure to the chemicals considered solely via the inhalation route. The target population of the study is laboratory staffs who actively involved in the maintenance work at the laboratory. To evaluate areas to be studied for this project, a brief selection was done based on the chemical health risk assessment reports that had been submitted to the Office of Occupational Safety and Health, UPM. There are more than 10 reports dated back to 2013. However, the selection was done based on few criteria in which monitoring of chemical exposure is highly recommended by the auditor. To systematically evaluate the selected study area, which is the anatomy laboratory of the Faculty of Medicine and Health Science UPM, the methodology is divided into two main parts. As you can see here, Figure 1 shows the flowchart of research methodology. In the first part of this research, modeling of chemical exposure via IH mode is performed. Under this method, input data collection was done by analyzing the CHR report as well as the safety data sheets. Also, under this modeling, we have to identify exposure models suitable for our specific system of exposure. In the second part of the methodology here, as shown in the figure, Aloha simulation was performed for two types of accidental releases. First, we developed the two release scenarios with different release rate of chemicals as well as the environmental conditions. And then we set up the parameters. Since there are two different scenarios, we fixed some parameters for both of the scenarios, and we also manipulated some of the parameters to make the two scenarios unique to each other. And then as you can see here, figure 2 shows a schematic drawing of exposure scenarios for the first part of the exposure modeling. And the room types are labeled here on the right side of the figure. At the end of this research, we successfully obtained the two types of results. First is the exposure curve for in respective to our objective 1, and also the distance downwind to the ERPZ levels, which answers our objective 2. So for objective 1, we successfully generated 3 types of exposure curve for 3 types of scenarios, scenario 1, 2, and 3. And the 3 scenarios are as specified here in the tables. So as you can see here, for all 3 scenarios, the permissible exposure limit stipulated by DOSH were extremely exceeded by all 3 exposure scenarios, indicating that the workers are extremely exposed to hazardous chemicals during their lab maintenance procedures. As for the second objective, the results that we obtained shows that the distance downwind range from as small as walking distance from the release source as far to the up to 4 kilometers from the release point. And out of all the 3 types of chemicals analyzed, we can see that formaldehyde shows the greatest dispersion of chemicals for the accidental chemical releases. This may be attributed to the high volatility properties of formaldehyde in comparison to the other 2 chemicals. So in conclusion, we can conclude that the work procedures in the laboratory extremely need a review and a suggestion for installation of localized exhaust ventilation system is installed in the laboratory, since the current ventilation system are only installed on the walls and are not sufficient to cover the large involvement of chemicals in the work procedures, hence indicating a very high risk to the workers. I think that marks the end of my presentation. Thank you so much for listening.